By way of introduction, I'm going to show a short PowerPoint of the key screening views of the fetal heart. And as part of that, it's really important that we understand the orientation of the heart within the chest. Here is just a diagrammatic representation of baby with a heart as shown. But heart is essentially a near midline structure, but with the apex of the heart here pointing anterior and to the left. The fetal heart is in a more horizontal position than it is during childhood or during adult life, and this affects the reference points which we use to orientate ourselves within the fetal chest. If we look at the antero-posterior relationships of the heart, we can see the superior vena cava coming down into the right atrium here, and the inferior vena cava also. The right atrium and right ventricle are more anterior than the left ventricle, which is seen here, and the left atrium, which cannot be seen because it is in behind the right ventricle and right atrium. We can also see that the pulmonary artery arises most anteriorly, with the aorta being tucked in behind, such that the pulmonary artery is anterior and to the left at point of origin from the heart. So the right ventricle is anterior, the left atrium is the most posterior structure, and the right ventricular outflow tract is wrapping around the left ventricular outflow tract, as we see here. The pulmonary artery is to the left of the aorta and slightly anterior to the aortic valve.